Hello, everyone. My name is Jose Hernandez. I'm with NYC Spinal.
Hi, I'm Jessica with BCID, and I'm repping my shirt today. Hey! And we got the wonderful Stephanie here with us today, our ASL interpreter. And we also have Shakia Britton, who is also staff at BCID. Hey, girl. Uh, yeah, so before we go ahead and get started, if you guys have any questions, please put them in the Q&A section. And of course, as always, chat amongst yourself in the chat box.
Also, for those who need closed captioning, we have live transcription using Otter AI. And if you wanted to see them, just click on the closed captioning button. As well, as you can see,
could you put them on? Because it helps me if I missed any spoken words. The captions help me too.
You can actually just click on the closed captioning button at the bottom.
Thank you.
And as you can see, we're in a webinar format. You could only see the panelist, and you're in attendee mode. So if, again, like Jessica said, if you have any questions, please put them in the Q&A section. And Shakia, please introduce yourself and we'll get started.
Hello, everyone. My name is Shakia Britton, and I am the benefits advocate at BCID. I've been with BCID for over 5 years now, and this is a role that I love. I enjoy helping people with disabilities and teaching them about benefits and what they're eligible for and how to maintain eligibility. And I've been in the advocacy field for about 10 years overall. So my field has always been to help and assist people with disabilities and their families. So I'm super excited to be helping you guys today about learning about governmental benefits and showing you how to apply and maintain benefits as well.
So you have a PowerPoint presentation for the folks.
Yes.
Would you like to get started?
Yes, I have a PowerPoint presentation for you all, and I'm going to get started.
We are.
There we go.
I'll ask you, sorry.
Okay, so the topic of our presentation is understanding governmental benefits, how SSI, SSDI, work incentive programs, Medicaid, SNAP can help people with disabilities. Again, I'm the benefit advocate at BCID. I have about 5 years of professional experience in this role as a benefits advocate. I'm also a certified work incentive coordinator. So I help individuals who have benefits such as SSI, SSD, and who would like to go back to work, understand how working will affect your benefits before being hired, while you're working, and after you leave employment. And my overall purpose in this role is to help individuals understand the right benefit at the right time and making sure that you are the right person for the benefit. So today we're going to cover a whole list of topics, okay? So let's just say that we are having a discussion. We're face to face, and I'm talking to you about things that you may have questions with. So we're going to be covering Social Security, SSI, which is Supplemental Security Income. We're going to be talking about SSDI. We're going to be talking about Medicaid. We're going to be talking about the MBI program for people with disabilities who are working and still would like to maintain Medicaid. We're going to be talking about SNAP. And lastly, we're going to be briefly talking about work incentive programs for individuals who are working and who are also receiving Social Security benefits. So throughout the presentation today, you're going to hear a keyword, which is Social Security Administration. And when you're looking at the slides or the presentation, you'll see the word SSA. Whenever you see the word SSA, that means Social Security Administration. So firstly, what is SSI? I get that question a lot. People get that confused all the time with SSDI, but they're very distinct benefits. SSI stands for Supplemental Security Income. The eligibility is for people with limited income and resources who are disabled or blind and age 65 or older. Children who are blind and disabled may also get SSI. There's also a resource limit to what people can have to be eligible for SSI. And that is for an individual or a child, $2,000, and for a couple, $3,000. So just to make it very simple, this benefit is also known as a welfare benefit, and it's based on financial need. Financial need. SSI is paid on the first of the month by the Social Security Administration. Social Security also has a calendar. So if any of you guys are interested in getting calendar in terms of payout dates for SSI and SSDI, you can contact me, which is at the end of the presentation, my contact information, and I'll send you guys the calendar and all the other resources that I'm mentioning today. You'll have that as well. For the SSI amounts for 2021, Social Security allots a certain amount of money for SSI recipients, and it changes per year based on just the cost of living, okay? And this year, the benefit amount that you can get on SSI is $794 for an individual and $1,191 for an individual with a spouse. This amount varies. So for a person who's working and is earning under a certain guideline, that amount, $794, is not the full amount you would get. And I'll talk about that later on in the presentation. But for now, for an individual who is solely on SSI, the amount would be $794 or up to $794. How can an individual apply for SSI? You can contact me. You can contact BCID. The contact information, again, will be at the end of the presentation. And I would be able to help you apply online. You can contact our office and schedule an appointment with me, and then I can walk you through it. I'm very thorough, and I will assist you with all the questions that you may have. And we're about choice. So if you decide not to contact us for whatever reason, you can also contact your local Social Security office to schedule a telephone interview to file for SSI benefits. I'll tell you right now, that is going to be tedious because there is a huge backlog with the Social Security Administration in terms of appointments. So agencies like BCID, who's a nonprofit organization, can help with submitting applications, and that would be considered like a third-party claim. So if you contact our agency, we could help you submit the applications online, and I'll be able to walk with you step by step on what documents you need, understanding the questions that they may ask, and just making sure that when you do contact Social Security for that initial appointment, you have some, understanding of what's going on. To find your local office, guys, it's really easy. It's called Social Security Locator. So there's a specific link that I have on this PowerPoint, and trust me, we'll send all those resources to you. You can click on that link and it sends you directly to this page, and you type in your zip code and it gives you your local office based on your zip code. Social Security is very strict in terms of their jurisdictions. So once you type in your zip code, you'll be assigned to a specific office, and they would help you with any questions or any applications you submit. And because of COVID-19, all offices, all Social Security offices have suspended face-to-face service to the public until further notice. So as of March 17, 2020, which is almost going to be a full year, they suspended it. So the only exception Social Security would make is dire need cases, and if you need one-on-one assistance and you can't get it via online or through the telephone, they would make exceptions, but it's case-by-case basis. So the definition of disabled, so all the programs that I'm going to be mentioning today is defined by one thing, the definition of having a disability. So the way Social Security Administration defines disability under their rules is if you cannot work because of your medical condition, you cannot adjust to other work because of your medical condition, and you had a disability that lasted at least 12 months or longer. So if you were working before and you have a medical condition and you can no longer do the work that you are doing, if you cannot do any other work based on your education, because they look at how long you've worked, they looked at your educational experience, and you cannot do any other work under your field because of your medical condition, and your disability has lasted 12 months or longer, they'll consider that a disability as well. So that definition of disability affects your ability to apply for SSI and also SSDI. So I'm going to talk about what is Social Security disability insurance. To qualify.
I'm going to interrupt 1 second and say something about the qualification. I think there's one of them that says that if you are, if you have a disability already and your disability gets worse, you can also apply for SSI or SSDI depending on the work situation.
Yes, thank you for that, Jose. Yes. So a lot of people with disabilities do have jobs and they are gainfully employed and they identify with a disability, and at certain times you can have a disability and come to the point where you may not be able to work the position that you're in. You can also apply for disability, like Jose said, and go that route as well. Okay, hold on. To qualify for SSD, you must have work jobs where Social Security tax were taken out of your check. So Social Security disability insurance is an insurance that you can apply for where taxes are taken out of your check. You have to have a medical condition that meets disability requirements, like I mentioned in the previous slide, and you have to have work credits. To qualify for disability benefits, it depends on your age when you became disabled. So the required amount for work credits is usually 40 credits, right? 20 of which were earned in the last 10 years. So for instance, if you are disabled and you meet the requirements from the previous slide, like I mentioned, they would look at the time you became disabled and then they will count back 10 years. They would also look at your education. They would look at your work history, and then they would look at your medical history as well. So you have to be in current care. You have to be seeing a provider, a physician. If you have mental health disability, if you have a physical disability, if you have a cognitive disability, all that needs to be documented. And you need to be in some sort of treatment because you need to show Social Security that you are indeed in treatment. Social Security only pays for total disability. They do not pay for partial disability or short-term disability. That goes through the state. State and city benefits only cover partial disability and short-term disability. Social Security is a federal benefit, so they only cover for total disability. How does Social Security determine that you're eligible? I get this question all the time. I'm disabled, I can't work, I have all these diagnoses, but I keep getting denied. This is one of the formulas that Social Security uses to determine whether or not you are eligible. They're going to ask, are you working? Is your condition severe? Is your condition found on their list of disabling conditions? Can you do the work you did previously? Can you do any other type of work? If you answer, are you working? The answer is no, you're not eligible for SSDI. If is your condition severe? So that will couple with, is your condition found on the disabling list? So Social Security has a list of impairments that they refer to when reviewing your case. And if your disabling condition is not on that list, then they would do a case review for further information, and then they will ask you for more medical information to determine what's on your paperwork and if it meets any of the definitions on that disabling condition list. They have released that list to the public. Not all conditions are made available to the public, but they have released it. It's called a Red Book, Blue Book. I refer to that often when helping claimants, such as yourself, apply for SSDI, and that helps for a strong application. Can you do the work you previously did? So they look at your job history. They look at how long you've been employed, and they look at when you became diagnosed, and they also look at your symptoms. So does your symptoms and also does your medication affect your ability to completely do your job? And if not, can you do any other type of work? So if you can't do the position you were in before, can you do another position that's in your field based on your education and experience? And if that's a yes, then applying for or being approved for SSDI as a no. So it's on a case-by-case basis, especially with these programs from Social Security. And any questions that you may have, you can put them in the chat, and then we can discuss them at the end and go from there, okay? So I would suggest, because it helps me, if you have a question, write it down on a sheet of paper or something so that you don't forget the question that you have, because this presentation is a little lengthy. So I'm covering a whole lot of topics. So if you have a question, just type it in the chat real quick, or you can write it down and refer to it a little later. So we're going to talk about Medicaid.
We actually have a few questions already. If you have a question, put it in the Q&A. You really don't have to write it down. Just put it in the Q&A and we'll get to them at the end.
Okay, awesome. What is Medicaid? So this is something that, I like Social Security, but I like Medicaid too, because Medicaid is, I believe, the bread and butter for a lot of our individuals who are receiving services. Medicaid is a program for New Yorkers who can't afford to pay for their medical care. That's just the simple term. You know, you have so many different definitions, but the simplest term out there is program for New Yorkers who can't afford to pay for their medical care. How do you know if you qualify for Medicaid? 3 simple criteria. You have high medical bills, right? You receive SSI. That's the easiest way to get Medicaid. If you have SSI, if you're an SSI recipient, you automatically meet the financial and resource requirement for Medicaid. So you get Medicaid automatically, or you're approved for Medicaid, and then you have to go through the steps of, you know, getting the coverage activated. And you meet certain financial requirements. How do you apply for Medicaid? I can assist you with that. So if you are a person who would like to apply for Medicaid, or who want to know that they're eligible for Medicaid, you can contact me, BCID, and we can walk through the steps, get you an appointment, and then we can, you know, move from there. And I can go more in depth in terms of the requirements, because it's, like I said, a case-by-case basis. Every case is different, based on the resources and based on if you're working and your household income and also your household size. Another option, because we are choice driven, you can contact the Medicaid helpline at that number 1-800-541-2831, and you can apply through the Medicaid helpline. For people, a lot of people don't know this. I'm giving you a really good tip. For people with disabilities who are applying for Medicaid, do not apply through the marketplace. That is, in short, very confusing, because if you apply through the marketplace, that is for individuals who want to apply for affordable and also private healthcare insurance. So people with disabilities, you have to apply through your local Medicaid office. And you can find that out by contacting me, and we will, based on your zip code and your address, we'll determine where your local Medicaid office is, or you can contact the local Medicaid helpline and they will let you know where your local office is, and you know, you can move from there. The Medicaid offices, the HRA offices, are limited to the public because of coronavirus. So they are going to be pointing everyone either to apply over the phone or online. Medicaid eligibility requirements. How can I apply for Medicaid? You can apply through your local Medicaid office. You are between the ages of 65 or older or have a qualifying disability. You are receiving long-term care services. So if you're in a nursing home or you're receiving like personal assistance care services, you may be eligible to apply for Medicaid. You're receiving MSP, which is the Medicare Savings Program. That's for individuals who are applying for Medicare, right? Or who have Medicare that only covers 80% of like your health insurance, and you need the 20% covered. So usually if you have low income and you meet a certain financial requirement and you need a secondary insurance, usually individuals who have Medicare both have Medicare and Medicaid. So Medicare would cover the first part, and whatever Medicare doesn't cover, Medicaid picks up and covers that. Another eligibility requirement, Medicaid buy-in for working people with disabilities. People who were in foster care or who are in foster care until age 21, they're considered a ward of the state, so they automatically get health insurance through the state. Medicaid is a state program. So no, Medicaid is state federal program. So each state requirement is different. So Medicaid in New York City, New York State is different than Medicaid in Virginia, is different than Medicaid in North Carolina. So I have a lot of individuals who say, hey, I have SSD, I have SSI. It's too expensive to live here in New York City. Let me relocate. I'm not against relocation at all, but a lot of times individuals who move out of state come back to New York because they realize that their Medicaid does not cover a lot of things that they had in other states. Also, if you're a resident of an adult home or nursing home, you're eligible to apply for Medicaid. The resource levels vary depending upon your situation, but a lot of individuals who are in nursing homes do have Medicaid coverage. And if you are receiving mental health services through OMH, a lot of their treatments are covered by Medicaid. So in order for you to get mental health services through treatment centers, community residences, they require you to have Medicaid in order for you to be covered by the services. And if not, if you can pay out of pocket, that's totally different. But these services are very expensive. So they would, they suggest that you apply through the state in order for you to get coverage. Medicaid determination. So a lot of people, I get these a lot. I applied for Medicaid and I didn't hear anything back. There is a period of determination that Medicaid has in order for individuals to get their eligibility letter, okay? So Medicaid must finish its determination of eligibility by sending you a letter after you submitted your application, stating whether you have been approved or denied within 45 days of your application date. If you haven't received any notification within that 45-day window, you can call the Medicaid helpline. If you're still not getting any feedback from the Medicaid helpline or your local office, you can call me and we can go over the letter and let's see where we could get some sort of answer. Usually I may have a contact or a resource and we can go a different route that may be helpful. If you're pregnant and applying on behalf of children, a determination should be made within 30 days of the date of the application. And if you are applying and have a disability, you must be evaluated. It takes up to 90 days to determine if you're eligible. So I'm going to talk about the determination piece in terms of being evaluated for the Medicaid Buy-In Program because it goes hand in hand. Now, this is my favorite program under Medicaid because it gives a lot of people with disabilities who are working or who want to work more flexibility about keeping their health insurance. A lot of fears that I've heard over the years, I don't feel comfortable going back to work because I don't want to lose my Medicaid. They're comfortable with losing the SSI or they're comfortable with, giving up SNAP benefits, but the Medicaid portion, they're not too comfortable with because that's affecting their quality of life or quality of care. So a lot of individuals I work with use home health aides, home attendants, or they have doctor's appointments and specialists, and they don't want to risk losing their health insurance because they decided that they wanted more independence by going back to work. So the Medicaid Buy-In for working people with disabilities offers Medicaid coverage to people with disabilities who are working and who are earning a higher wage than what regular Medicaid limits allow. Now, if you're receiving, they call it straight Medicaid or regular Medicaid, there's a certain limit that you can have in terms of your household income. And if you go over that limit, even by $1, like you won't have your Medicaid. So with Medicaid buy-in for people with disabilities, this is saying, hey, we're giving you a safety net so that you can be independent, be employable, and still keep your health care. Yeah.
I'm gonna jump in here a little bit. There's other, I don't think you had the Social Security program for SSI recipients. There's a program called the 1619B program that allows you to make up to, I think it's $50,000 before your Medicaid is affected. And as far as the Medicaid buy-in program, you have to pay a monthly amount, but that is determined on how much money you make. So let's say you make $90,000 a year, you're able to continue receiving your Medicaid, but you have to pay, I don't know, $150 a month.
I think they postponed it, I call it a copayment, but they postponed that, so you don't have to pay the $150.
But in certain cases,
in certain cases.
Yeah.
But if you go over the 64,000, and I have it in the PowerPoint, if you go over that, then that's a different story. But usually there's a specific income guideline that they have, especially under the Medicaid Buy-In Program. Eligibility. Okay, so for eligibility for the MBI program, like how do they determine if you have a disability under the Medicaid Buy-In Program for people with disabilities? So Medicaid uses the Social Security definition of disability when determining their eligibility requirements. So the same disability definition I mentioned earlier in the slides is the same definition that Medicaid uses to make that eligibility, because they go through the state. They go through a state determination board to make that decision. So the same decision, the same definition they use for SSI and SSDI is the same definition they're going to use when making a determination for individuals with disabilities who want to apply for the MBI program. If you have not been certified for certified disabled through Social Security Administration, you need to have a disability review done by the state disability review team. So the way that works is you can contact your local Medicaid office and they can assist you with the steps of getting certified. So you let them know that you want to apply for Medicaid buy-in for working people with disabilities. They know what that is. Earlier when the program first came out, there was a lot of confusion about what program to put people in, whether it was Medicaid or whether it was the Medicaid buy-in, but HRA and they know what that is. So you just have to be very straightforward with them when you want to apply, saying that I want to apply for this particular program. If you are already receiving SSI or SSDI benefits, you should have an award letter. If you don't, you can contact your local office, or you can get a copy of that online through the My Social Security portal. You can download that form or that letter, and then you could submit that as proof of disability when you're applying for the MBI program through Medicaid. And that way you don't have to become certified disabled through the disability review team, because you already have SSI or SSDI. You just have to submit the letter along with an application. To qualify for the MBI program, you must be a resident of New York State. You must be a resident of New York State. You cannot have another residency in a different state between the ages of 16 to 65. You have a disability defined by the Social Security Administration. The same disability definition they use is the same one Medicaid uses as well. You must be engaged in work. That is the purpose of the buy-in program, is to assist individuals who are working part-time and full-time. Your gross income level. The cap, I believe, yeah, it's $64,836 for an individual and $87,288 for a couple. If it goes over that limit, there is a buy-in fee, but as far as I know, that has been postponed. I'm not sure when they're going to resume that, but it's a case-by-case basis. So each case is different depending upon the person's resources and wages, because a lot of these programs, such as SSI and Medicaid, are based on resources. And then in terms of eligibility, your resource level. So when I say resource level, I mean bank account assets. It cannot go over a certain amount. So for an individual, that's about $20,000 for one person household, and for a two-person household, married or you're in the same household on the mortgage or the lease, it's about $20,000 for a two-person household as well. But that's resource level. That's talking about assets like bank accounts that you may have. Do we have any questions, Jose, before I move on to the next?
Yep, you want to address some questions?
Or should we wait until the end?
How many slides do you have left? We have 20 minutes.
I can go faster. Snap. I think I'm almost there. I can't see it from my end, but I think we're almost there. I'm sorry. I know this is a little cut and dry, and I'm sorry I can't make it more animated, but we're talking about federal benefits and we're talking about state benefits, and I'm trying to give you guys accurate information. So I don't want to be like, this is what it is, but I wish I could be more like, woo, but you know, when we're talking about your benefits, this is serious stuff, okay? Maybe we can, have some fun when we reach the end of the presentation, but for right now, I have to give you the information that I know. So for SNAP, SNAP is, also known as food stamps, and it provides assistance for, New Yorkers, families, people with disabilities, to help them cover the cost of their food. How can you apply for SNAP? BCID can assist you with submitting an application online. If you choose not to go through us, you can apply through Access HRA, which is an online portal where you can apply for SNAP. The links and everything to apply to all of these programs will be sent out, so you have that for your records. And if you choose not to do the online thing and it's too hard for you, you can call the information line at 718-557-1399. And you can have an application mailed out to you, or you can do the application over the phone through the info line with the HRA representative. SNAP eligibility. So like every other program I mentioned is based on resources, and it's based on income and household composition, the people in your household, basically. Your household income determines whether or not you're going to be approved for SNAP. Simple as that. A SNAP budget must be calculated in order for the HRA to determine eligibility for SNAP, right? And the only way to determine if you're eligible or not is to apply. And so all my individuals who I work with, the best thing to do is just to submit an application. Don't count yourself out. You'll say, well, I make too much, or I don't think I qualify. The best person to make that determination is the program itself. So submit an application. Submit an application for SSI and let them tell you whether you're approved or denied. Submit an application for SSDI. Let Social Security determine whether you're eligible and whether you are approved or denied. Let Medicaid determine if you're eligible, whether approved or denied, because you never know. Case by case basis, circumstances are different for each case. So what I'm sharing with you is just common knowledge and the basic requirements for the programs, but every rep will tell you case by case basis. So as an advocate, when I call these different places, they'll tell me, Ms. Britton, case by case basis, this is the foundational eligibility requirement across the board. This is the guidelines, but case by case basis. So you can meet the eligibility guidelines, but your situation may be different from your neighbors. It may be different from your coworker. It just may be overall different. So you never know until you apply. Now I'm going to throw some numbers out there based on household. I only did up to 3, just to kind of give you an overall of what your maximum benefit amount would be based on your household. So if you're one person, the allotted amount, the maximum you can get for one person as of October 2020 is $204. The amount fluctuates because it depends on if you're working or if you have other resources, if you're already getting other supports from state, local, federal agencies. It depends. So the maximum amount that you're allowed to have is $204. For 2 people, it's $374, excuse me. And for 3 people, it's $535. Eligibility is based on 3 different categories. All of this information I've gotten from my resources that I reference. If you want the source of where I'm getting my information from, all those links will be provided, and it will take you straight and directly to the websites that I reference. All of these information is coming from federal and state websites. So I'm not getting it from like a third-party agency. I'm getting it directly from the source. Eligibility is based on 3 different categories. Income for household with earned income. That means you're working. That means you're bringing in a wage. That means you're working and taxes are taking out of your check. So that's considered earned income, income that you have worked for. Income for household with earned income. So it's without earned income. I'm sorry, that is Social Security benefits. So SSI and SSDI are considered unearned income. You have not physically worked for the benefits that you're getting with SSA, Social Security Administration. So these things, so SSI and SSDI are category classified as unearned income. Household with elderly or disabled members. So they look at what you're getting from state or federal benefits. They're looking at that and how much you're bringing in through pension, through your retirement. So they look at all these different cases. So you fall under one or the other. And this is the most
I'm sorry, Shakia, I'm going to interrupt you really quickly just because of the interest of time. And I know Stephanie has to leave at exactly 3. So if you want to, we can share the presentation. I went ahead and put my email in the chat box and your contact information as well.
Oh,
But
okay.
if you want to go ahead and hit some of the questions on the Q&A, we can go ahead and do that. And what do you think, Jose? Good?
This is actually my last slide.
Oh, well, then go for it. I'm
there
sorry.
you go.
Made it. Listen, we have a time crunch and I actually made it. Okay. So SNAP recertification. This is the number one question I've gotten from a lot of individuals. How do I recertify for SNAP if I already got it? So because of COVID, everything has just changed, right? So recertifications are actually extended up to 6 months. So for instance, if you have a recertification due between January of this year and March of this year, it's extended for 6 months for those who did not get a previous extension. If eligible, HRA, I'm pretty sure you probably got a letter in the mail stating about the extension. If you're confused and you need assistance with submitting a recertification form, please contact our offices and schedule an appointment with me, and I will help you with the recertification form. If not, you can always contact the HRA info line and say, hey, I got this letter in the mail about the recert. I don't know what to do, and then have them walk you through it. But if you want me to assist you with that, I can do that as well. And if you've missed your recertification interview and you need to reschedule, the number is 718-722-4924. And if you can't get them at that line, I always direct people back to the info line.
All right. Now you have the last slide with your contact information.
Yeah, and that's my contact information. So if you want to schedule a consultation about how work can affect your benefits, that is a totally different presentation in itself. I couldn't fit this in this one slide because it's just extensive. But if you want a one-on-one consultation with me, it's about 30 minutes. I will go over work incentive programs that Social Security offers to individuals who are working and are receiving SSI and SSDI. And if you want to schedule an appointment with benefits on how to apply for SSI, SSDI, SNAP, and Medicaid, I can do that as well. So my email is here and the telephone number to reach me is also listed. I'm done.
All right. For those who are on the phone, the email is sbritton, BRITTION @bcid.org, and the telephone to contact her is 718-998-3000. So we're gonna go into some questions, and the first question that we received was, do I file income tax when I receive SSI or SSDI and work part-time? So does this person need to file taxes if they're receiving SSDI and work part-time?
So SSDI is considered unearned income. So that's something that you have paid into and that you're receiving. If you're working part-time, you have to file taxes. So whether it's part-time or full-time, you have to, file taxes. The short end. But if you need more information on that, we do have a individual who works closely with BCID who helps individuals, submit their tax returns. And that will be a phenomenal question to ask her. So if you want more information, you can reach out to me via email, and then I could forward that to the person that does taxes.
Okay. Wait, I still want in the chat that, do you want to do the Q&A? Okay, never mind. Sorry. Okay, so wait, what order does it go in? From the bottom or the top of I see it. Sorry. So how is SSI calculated for someone who has never been gainfully employed?
Well, SSI is considered a supplemental income. It supplements the income that you should have had if you had work history. So the question is, how do they calculate it?
Yes.
They calculate it by the requirements. So the maximum benefit that you can get is $794. So you have to meet the requirements of being disabled. So when I think of calculation, I think of working and receiving SSI. That's something totally different. So if you're just an individual who wants to apply for SSI, first you need to submit an application, submit supporting documents in terms of your medical history, and then show bank statements as well, because you need to prove that your resources is under $2,000, and move from there. But if you are still, not sure of like what I'm saying and you want further clarity, you can always reach out to me and I can, go step by step.
The following question is, do you have to be a citizen to apply for SSI?
Do you have to be a citizen? You have to be you have to, what is it? It's a resident.
Resident.
A resident. The term.
You have to be a permanent resident.
You have to be a permanent resident and you have to be here for a certain amount of time. I think it's about 10 years or so. I have a lot of people all the time contact me about that. And they have a qualifying disability, or they have a relative with a qualifying disability, but they do not have proper documentation. A lot of people have been here maybe a few years and they don't have a permanent residency card. You need to have the appropriate documentation in order to apply for a lot of these benefits. If you would like to talk more about that offline, you can reach out to me via email or give me a call and we can discuss that.
The next question, I'm going to take it from the chat. It says, I am collecting early Social Security. Can I apply for SSD?
You got early Social Security, I'm assuming that's early retirement.
So that is SSD.
No, say that question again.
It's like, I am collecting early Social Security. Can I apply for Social Security disability?
So my understanding when they're saying early Social Security, I'm assuming they're talking about pension.
I'm not sure about that question. Maybe reach out to Shakia.
Yeah, reach out to me, because if when I hear the word early as Social Security, I'm thinking early retirement, early pension, because you can get your pension around 62 for individuals who want to apply for early retirement. Yes, you can. If you're under 65, you can get SSDI.
I got a good question.
Frame is 16 to 65, 64 in a couple of months. Yeah, so.
We have another very good question. Is it
Okay.
if one is retired,
Yes.
without 40 credits on Social Security, but diagnosed with a disabling condition, how will SSA evaluate this situation?
If one is retired,
but diagnosed with a disabling condition, how would SSA evaluate this situation? They don't have the 40 credits they need to get SSD.
It depends on the work history. So for instance, have the person contact me, because that's a work incentive consultation appointment. And I could sit down with them and I could actually, there's something called the PPQI that Social Security has on all of their claimants, depending if they want to go to work. And I have to look at how many years you've worked and your credits. So do not base it off of, okay, I only got this amount of work history, because it depends on when you were diagnosed. And it also depends on how much you've earned, and also how long you how long you worked. So contact me and we can sit down and we can contact Social Security after I get an authorization to get your information, and then we could go line by line of how you may be eligible.
And I'm gonna take one
Wait.
more question.
Stephanie needs to leave, so I just wanted to say goodbye and thank you.
All right, take it easy.
Everyone.
Stephanie. It's 3 o'clock.
So do we take the other question, or we have people email the questions to?
That's up to y'all. I mean, we still got a bunch of people watching, so if Shakia wants to answer the question, go for it.
Let's take one more question, and well, for those who we didn't get the questions, to please email them to Shakia. The other question is from Maria De La O, which you guys know very well.
Hi, Maria.
Yeah.
Can an SSI/SSD recipient still receive benefits if he or she, for X reason, have to reside outside of New York State for a few months, let's say due to COVID, or because of a personal emergencies overseas?
No, you have to be, that's the short answer. And if you need document proof about that, I can send you a link that says that is your benefits will be postponed. You need to be in the States.
Yeah, it's definitely not allowed.
It is not allowed. You will risk losing your benefits, or your benefits will be postponed. And Social Security has a way of finding that out sooner or later. So
because it's a federal program.
Yes, it is.
And state by state, it's funded half and half by both. So with that being said, I want to thank everyone who is in attendance. I want to thank Shakia. I want to thank BCID. And
yes, thank you for having me, and thank you for sitting through this extensive presentation. I know it's probably cut and dry, but I tried my best. So if you have any questions, feel free to email me sbritton@bcid.org or 718-998-3000. If you email me, give me at least 24 hours to respond, because I know I'm going to get a lot of questions, and I will try my best to respond as soon as I can. Okay?
Thank you.
everyone.
Thank you.
Thank you.